Chief Minister Siddaramaiah on Monday inaugurated a state-of-the-art centralized command and control center in Bengaluru to streamline emergency ambulance and healthcare services across the state. The facility was announced in the 2025 to 26 budget. The facility marks a shift from the public to private partnership model used for the 108 ambulance service since 2008 to a fully government-owned emergency response system aimed at improving accountability, efficiency and response times. The integrated CCC brings together services including 108 Arogya Kavacha, 104 Arogya Sahayavani, 112 Emergency Response Support System, TeleMANAS 14416, eSanjeevani Women's Helpline 181 and Child Helpline 1098 under one network. Officials said the system features GPS-based ambulance tracking, computer-aided dispatch, real-time hospital mapping, caller location detection, SMS alerts, digital patient records, and two-way communication between ambulances and the control center for faster emergency coordination. Developed on the CDAC NGER SSV 2.0 platforms, the facility includes a 50-seat call center connected through the state's digital and telecom infrastructure and will operate under senior IAS supervision to ensure rapid and efficient emergency response services across Karnataka. So viewers, in case of any emergency, you can now use services like 108, 112, 181 and 1098 for the immediate help across Karnataka. For more such updates, stay tuned to Daily Salar Digital.